all of a sudden, there I was, with rotten teeth. And my teeth were white, used to be white. And this one here, there was a cavity behind the filling. I didn't realize they were this ugly, I don't pay too much attention in front of the mirror, can you tell? But yeah, and this is what it was like when I came here. I was eating corn on the cob one day, and this tooth broke off. There was a cavity all the way across, and it just broke off at the gum line. And this was after I decided I needed to get something done, but that shocked me. It just shocked me completely. I took good care of my teeth, better care than my husband. He has no fillings or cavities, and I'm the one that all of a sudden just fell apart. So I've gone to the dentist since I was a little bitty girl, scared of dentists, but still going because you just need your teeth. Usually every 6 months would go to the dentist. If something needed to be done, then they did it, whether it was a filling or a cleaning or what. I always went about every 6 months. And then all of a sudden, I got busy and didn't go back for a year. The dentist I had said, Norma, I don't know what's wrong with you. He said, all of a sudden, you have a cavity in every one of your teeth. And I said, well, why? And he said, it could be dry mouth, and it could just be your age. I mean, I'm 80 now, so it's okay. But it bothered me. And he said, you can either have dentures, you can have implants, you can have root canals and crowns. It's just whatever you want to do. And so I said, well, I'm pretty sure I want to have implants. I don't want to have to do dentures coming in and out. And then my husband and I decided that maybe keep my teeth and just do the root canals and crowns. And then I went to different specialists. 2 of them gave me the same thing. I can have dentures, I can have the implants that can come in and out, or I could have the dentures that stay in. I didn't want to have to take them in and out and leave them in a glass of water at night or whatever. So I said, well, I would rather have that. Well, okay, but, And then finally the specialist said, well, if you do the crowns and implants, then if you get more cavities and we don't know what's going on with your teeth, he said, it's very difficult. And in a couple of years, you might be back in the same place. And so I went home, told my husband, and crying. And my husband said, don't worry about it, honey. We'll take care of it. We found Dr. Cheema, and this place is amazing, amazing. I tell all my friends how wonderful it is here. I opted to do the implants. I almost wish that my teeth had gone bad 50 years ago or 30 years ago, because I really do appreciate the color. I mean, they're a little whiter than I like right now, but I appreciate the teeth that I have now. I knew I didn't want dentures because I've seen different videos where they have sneezed or blown out candles or whatever, and the teeth came out. I've also have family who have dentures, and they're constantly complaining because food gets under them and it hurts, so they have to dismiss themselves, go wash their dentures, and then come back into the room. So I knew I didn't want dentures. I knew I wanted something that was going to be permanent, and I knew I couldn't grow my teeth back. So this is the best way to do it, is the implants. So that's what I decided to do. I still have just the temporary. I should be getting my permanent ones in the next month or so. So now I eat softer foods. I don't do any crunching, and I don't do any of the hard foods, but yet still good. I can't wait until I get my permanent teeth so that I can eat whatever I want, whenever I want, and a nice big thick steak, or maybe a hard piece of candy I don't know, just something that I want and not have to worry about. I don't worry about them now. Don't get me wrong. I do not feel, like I have to be so careful, because I did break once and I came in and right away they took care of me. They didn't say, well, what did you do? They just said, oh, don't worry about it, Norma. These things happen sometimes, Take such good care of me here. They're wonderful. They are truly, truly wonderful. Before, when I would smile, it was more like this, and now I can smile like this, So yeah, but always before, I would do a closed mouth smile, So yeah, this is much better. This is much better. I do appreciate these teeth. I am a different person. I was beginning to feel old, and I'm not that old. I'm going to live to be 100. I just want to live long enough that these teeth are paid for. No, you know what I mean, that I get good wear out of them. So it has to be at least 100. So I would suggest that anybody that should go ahead and, well, like I said, I appreciate the implants better than the false teeth. That doesn't matter. You have to do what you have to do and do what makes you happy. Yes, it might be a little difficult sometimes, but I think it's important that you are able to chew your food and to digest your food. And the way you can do that is by having good teeth. But I'll tell you what, I would do it all over again. I would do it all over again, because not only because I got beautiful teeth, but because they treat you so well here. They just really treat you well. And that's my own opinion. And I tell everybody how wonderful they are. I know that if anybody's like Dr. Cheema, then they would take good care of you. And I mean, the people who work here are great too. I feel like I come home to family when I come here. That's just how I feel, truly.